Good afternoon. Welcome to the St. Clair County EMA Daily Briefing. Joined once again by Sam Bierman from the St. Clair County Health Department. Sam, you've got some updates for us today.
We do. We have some new numbers for you guys. As in reports past, all of the numbers that I will be giving to you in the first set for St. Clair County are St. Clair County residents that have been tested. We are at a total of 378 people that have been tested. We are at 50 positive, which is 7 new from yesterday. Those are 2 males in their 40s, 3 females in their 40s, a male in their 50s, and a male in his 70s. And all of those are community spread, which simply means that they have not had any travel in the most recent few weeks. We are now at 230 negative tests, 98 pending, and 2 deaths. State totals are as follows. 40,384 have been tested. We are at 6,980 that are positive, and that is an increase of 986 since yesterday. And we are at 141 deaths, which is an increase of 42. One thing I would like to mention that was brought to my attention today is that when we do these reports every day and we see these numbers, it seems to be wearing on people. You know, they think, we keep hearing these numbers and they're getting worse and they're getting worse, and it's becoming heavy on the shoulders of all of our county residents. And what we would like to remind you is that when we're doing the shelter-in-place order, when we talk to you about social distancing, this is so we can see the light at the end of the tunnel. And we are working our hardest, as with all of our county partners, to be on the upswing of this, and your cooperation is much appreciated, and with your cooperation we will get through this together and we will see the light at the end of the tunnel. So now I would like to introduce Chairman Mark Kern for his report.
Thank you, Sam. Yeah, and I think also to follow up what Sam is saying, the light at the end of the tunnel is a ways away. Time-wise, I think we're looking at least a month until we start to see numbers changing. So it's important that we don't, look for this week or next week to see a difference in COVID-19. I think we're not going to see that difference until the end of the month, and I think that's the reason why the shelter-in-place order has been extended until April 30th by the governor. But it's going to happen. We're going to be there. We're going to be back to normal, and I think that's going to be a welcome thing. It's been announced by the Department of Defense that a civilian employed at Scott Air Force Base has tested positive for COVID-19 and is currently at home recovering in accordance with CDC and their physicians' recommendations. The member had been in a telework status from home since March 18th and was not symptomatic at that time. The individual received the test on March 26th, which was confirmed on March 30th. And this is, again, a non-travel related case. So community spread is why we're all staying home and why we're washing our hands and doing all these important things. Team Scott encourages all base personnel and families to stay informed on COVID-19 with updates from the CDC and base level communications, including the base website and the Facebook page. So that's an important update from Scott. Most people are following the shelter-in-place order. We have received a few complaints about stores. We want to, once again reiterate, stay 6 feet apart, practice good hygiene when you go out to the grocery store. Try to limit your trips to the grocery store to once a week if possible. I know that's not always possible, but I think it would improve the numbers that we see gathering at the grocery store, at least all being in the grocery store at one time. Some people, though, aren't following the shelter-in-place order, and last night in North Dupo, a tavern owner decided to open for business. They were serving alcohol, at which point the sheriff arrived, took their liquor license and their business license, and of course now their status as a business owner is pending and may not resume because of the violation of the executive order of the governor's office, as well as St. Clair County's order to stay home and close the liquor establishments. So for retail operation. So the point we got to make is we got to stick with this. It is not okay to open up your bar and attract people there. The reason why we have the shelter in place rule is because we don't want people congregating and we want to stop the spread of this virus. So it's also important that we find out and get updates from our medical community. Today, we're joined by Phil Pugh, Emergency Management Director at Memorial Hospital in Illinois. And Phil, tell us what's going on in emergency management these days. How has their life changed, and how are they holding up?
Oh, thank you, Mr. Chairman. I'll say this, from the medical side, and from my specific role as an emergency manager in the medical community, what we're doing now is trying to really balance patient to staff ratios, trying to get staff members in a position where they can positively impact change for what patients we see day to day. And granted, while COVID-19 is what we're dealing with at a large majority, people still get in car accidents, people still break their legs, ankles, and they still have to be seen at an ED. And we want to best manage their care by sending them to a spot where they can be taken care of properly.
So what has changed? If something would happen that's non-COVID related and I call for an ambulance, how is that treated? Is it treated any differently than it was before March 1st when all this kind of started to blow up?
Absolutely not. If you have a medical emergency, you dial 911, EMS is going to pick you up and get you to the closest, most appropriate facility, bar none. That's going to happen. We haven't changed those things. What we do ask, though, is if you feel as though that you have an issue that could wait. You may feel a little different today than you did yesterday. Monitor yourself at home, talk to your primary care provider, and then make a decision on whether it is an actual medical emergency. That way, we leave room for the folks that are truly in need of medical care at a hospital.
If someone is feeling like they have the COVID-19 virus, they watch this on TV, they've seen the symptoms, we've talked about the symptoms on here, and they call for an ambulance, what should they expect to happen?
So what they should expect to happen is the medical folks that will, or excuse me, our EMDs, our emergency medical dispatchers will review what they're presenting as a problem, and they'll try to direct them as best as possible depending on their signs and symptoms. If those signs and symptoms warrant a transport via ambulance, they'll ship an ambulance out. If not, they'll ask them if you could contact your primary care physician. If they feel as though they need to be transported and it's still an emergency, in their mind, they're going to get transported. They'll be evaluated at the closest, most appropriate facility, and that physician, once they got there, will tell them, sure, we're going to either admit you, or this is my recommendation for you to go home, self-care, and follow up with your primary care provider.
So it's pretty likely that the 50 cases that are positive in St. Clair County, the vast majority of those didn't go to the hospital via an ambulance.
True indeed. A lot of folks will self-present via vehicle of opportunity. Maybe their spouse will bring them in, or they'll drive themselves in. If they're really, really incapacitated, an ambulance is the best choice. So dial 911 if you feel incapacitated, if you feel like you're lightheaded, chest pains, all of those things. We want to make sure we get an ambulance out to you and somebody can drive you in.
How are your capacity? How's the capacity issue going? Do we have enough ambulances, drivers? Are they getting worn out? Or we thank them every day for their service. Are they taking care of themselves too?
They are, and they are a vital point in this. If we are to rely on any of the estimates coming up over the next 2 weeks, we could see an increase in cases. They are right on the front lines with exposures, and we want to make sure that they're protected as well. So while the volume and the censuses in the hospitals have kind of dipped down a little bit lower, the level of acuity of patient and what the needs are for patient care have increased. So a traditional hospital, let's say, may have a day-to-day census of 185. Today, that census may look like 100. You may have 100 patients, but those 100 patients require more hands-on care. So the same could be said for the field medic. So as we get more calls, if the field medic gets sick, that leaves less hands to put on patients and do the right thing in the field. So we're trying to take care of them as best as possible. So they're monitoring themselves daily. All of our transport agencies have instituted daily monitoring, temperature checks twice daily. So they're checking themselves, and if they have an exposure to a positive patient, they're going out and getting tested, and when those test results come back, we're getting them back on the road as quickly as possible.
So if you need an ambulance, don't hesitate to call.
Bottom line, you're exactly right.
So Herb Simmons is here, and I know Herb's got questions as a former ambulance company owner and ambulance driver. Herb?
Well, thanks, Chairman. Phil, appreciate you coming in. And I know you've been burning the candle at both ends. We've talked a couple different times since this started. On the EMS side, you get to talk with our paramedics, our EMTs on a regular basis. Mm-hmm. Are you feeling any of that stress level rise over this pandemic?
Both our field medics and hospital providers are feeling the burn right now. They know it's not over. As the chairman said, we're going to keep going through this, but they need resources. We have resources that are out there to help them provide. Traditionally, you may see it in, let's say, a mass casualty incident or traumatic incident where we have our critical incident stress management teams help out those medics. But today, we can receive calls from medics that are just worn down and tired of going back to work, and seeing what they're seeing day to day, worrying about their families and if they're going to take something back to their spouse or their children at home. So that's where the kind of core worry is. They don't worry about themselves so much, but they're worried about the people that are around them more than likely.
And that leads me to my next question. We get quite a few inquiries from spouses wanting to know if their spouse is going to be safe out there because they're on the front line in the EMS business. Can you speak to what extra precautions under the universal precautions that they normally would take? Is there anything extra that we can reassure the spouses of those people on the front lines of what you're requiring them to do?
So as a responding medic, they're treating all, pretty much, I can't say all 100%, that's a bad word choice, but I'd say if they have any slight inkling that they're going to respond to an influenza-like illness or anything similar, they're taking appropriate precautions once they arrive at the house. They're keeping their social distancing when possible. They're asking the questions. If they're talking to other family members, again, they're maintaining their social distances. They're wearing the proper protective equipment. There's been a lot of discussion of you see it day to day, who's receiving personal protective equipment, who's receiving masks, so they're out there, they're putting on their masks, they're wearing their gowns, they're wearing their face shields, they're wearing their goggles. There's plenty of times where we've had folks that were short, and we've had some supply side issues, but those are starting to rectify themselves. We've had issues where folks are starting to reuse PPE and things like that, but those are starting to rectify themselves. So as the supply side starts to catch up and our strategic national stockpile continues to deliver supplies, we're going to make sure that they're receiving those supplies. We ask that any person, or any type of provider, when they go home, change your uniform. Don't take what you're wearing day-to-day in patient care anywhere close to your family. So take that uniform off, maybe put it in a separate bag, and then wash it, and then put on a fresh pair of clothes when you go home, and practice all your hand hygiene as you would day-to-day.
Okay, good. One last question. Can you tell our viewers your position as the coordinator director of the RHCC and what that all entails?
Okay, sure. So I'm the regional hospital coordinator for the Edwardsville region, which is the southwestern 11 counties and 19 hospitals. What we do is we try to serve as a multi-agency coordination system, which means nothing more than we coordinate supplies, and we try to balance the load sharing of hospital patient care. So if we're seeing patients that have an extremely high census, or maybe their ED is shut down for an extenuated amount of time, we try to help coordinate the response so as the healthcare system across our region doesn't shut down. Because if one hospital is impacted, regardless if I work for Memorial Hospital or if I work for another agency, if one hospital is impacted, it affects all hospitals. Same could be said for our ambulance companies. If one ambulance company shuts down for whatever reason, that puts a stress on everyone. And we want to try to balance that as best as possible.
Well, very good. I appreciate that information. And like I said, we're going to get through this, and I know you agree. We want to remember those medics and EMTs and out there and keep them safe, and hopefully their spouses that follow our page will understand a little bit more that you're helping them maintain that good universal precaution. Very good. Thank you.
Thank you.
Stay safe, Phil.
We will.
Chairman?
So, today is Census Day, which has been announced. That that form may be sitting on your kitchen table, wherever it is right now. You need to call in, you need to, or get online, not call in, but get online and fill out your census form to make sure that we get counted by getting an accurate count in St. Clair County, in Illinois. It affects the congressional districts. It affects all things that affect us. The number of dollars that flow to the area in an emergency like this, or normally every day, come based upon a population count. So it's important that every person in St. Clair County gets counted. That form's there. It's simple. There's, I think, 5 questions. They don't ask citizenship questions. It's not a thing that is that anyone should fear filling out. It's an important document that we make sure it's filled out accurately to make sure we get an accurate count in St. Clair County. We're lucky today to be joined by somebody who's been a strong fighter for us to make sure that that we're receiving everything that we need to during this pandemic, and it's State Representative Jay Hoffman. Jay, welcome today.
Thanks, Mark, and thanks for doing this every day.
Sure, thank you. So have you got an update from the state of Illinois?
Well, I think that the Department of Public Health, Sam, kind of covered the numbers as we continue to see them rise. I think it's been our belief that we need to continue the shelter in place, and that is why the governor announced that we will continue that to a minimum of April the 30th. He also, I think, made it very clear that if there's any way possible that it could end prior to that, he certainly would welcome that. So would I. I can tell you that the calls that I am continuing to get in my district office, which incidentally we are open for business, although we're all working remotely. I'd like to, if I could, extend an invitation to any constituents or anybody in the Metro East area. I know our representatives and senators on both sides of the aisle are continuing remotely to work. If there's a constituent who has an issue, whether the issue is a small business that wants to take advantage of some of the new federal stimulus package or some of the packages from the Department of Commerce and Economic Opportunity. We know what a hit restaurants and bars and other hospitality type businesses have taken, and all small businesses as well as large businesses have taken, and we want to be there to help. In addition, if you are unemployed, you can call our office. We can help you with the unemployment process. Unfortunately, it's just been inundated by the huge number of people who have been laid off or have lost their jobs, to the point where we've attempted to say that if your last name of the alphabet is a certain way, that you then will go on Tuesdays or Thursdays, others Monday, Wednesday, or Friday. So please, we can provide you that information. Our phone number, and we'll still be answering the phone remotely, is 618-416-7407, or you can email our office, and we check the emails constantly. It's REPJAY Hoffman, HOFFMAN, @gmail.com. Some good news, I guess, if there is good news, is that we finally were able to get to St. Clair County Emergency Management and to Herb and his folks 2 pallets of PPE, or personal protective equipment, that came today. And that will be delivered to some of our first responders, to the local police and fire first responders throughout all of St. Clair County. I believe the same has happened in Madison County. They're getting a shipment as well. The governor and the governor's staff have been working so very hard to get as much testing equipment, PPE for not only healthcare workers but first responders and people who are in nursing homes or EMS employees, to make sure that they who are on the front line are protected. We're running short, and that's been well documented, not only in the national news but also some of the statements from the governor and some of the statements that you guys have put out. So we got to keep moving forward. Unfortunately, what I'm seeing is this is a national healthcare emergency that's being managed on a state-to-state basis, and then on down to a local basis. So we're going to have to step up and continue to step up in the state of Illinois. We really haven't received a lot of supplies from the federal government as of yet. I hope that they're coming. I trust that they're going to be coming, and they're going to help us out because, as you know, this can't be fought on a state-to-state basis. It needs to be fought on a national level. And although our state is really, really trying, other states still haven't put a shelter-in-place order. They are spreading the COVID-19 and not having and taking the steps that we have taken and the sacrifices that all our community and the individuals here in Illinois are taking in order to stop the spread of this pandemic.
Because when we finish with this, we want to be finished. We don't want it to boomerang back and come back.
Exactly.
Jay, I talked to you last night. I was out, saw a business owner in my neighborhood, and he's concerned about the future of small business in the state. You know, given the fact that most small businesses in the country are shut down, the programs you talked about, Illinois Department of Commerce. If they go on the Department of Commerce website,
Yes.
programs are listed.
Plus, there's also that'll all be listed. The local state programs, as well as frequently asked questions that can be answered regarding the new federal stimulus package. You know that it seems like our days are moving at a glacier pace, and it seems like we've been locked down for a long period of time, for months and months and months. But actually, it's only been a week and a half, or a little more than a week and a half. Restaurants and bars have been closed for a little bit longer, another week, I believe, other than that. But they just passed the federal CARE package, and it was signed by the president. That provides significant relief for not only people who have lost their jobs. You can now get up to $600 a week in addition to your unemployment benefits. People that are self-employed, people that are independent workers, independent contractors, gig economy workers, they all can now receive unemployment benefits. They used to not be able to. They can receive up to $600 a minimum per week for this period of shutdown, and I believe that that is a very welcome benefit to many families who are facing bills still coming in while not having their income from their employment. In addition, for small businesses, there are small business loans that are forgivable loans if you keep people on your payroll over a given period of time. There are also grants that are available, grants through the state as well as grants through the federal government. I think that probably this will be the first line or second line of stimulus packages, and as we get back into Springfield, we're going to address some other things that we can do on the state level to help out small businesses cope with the cash flow problem I guarantee that they're seeing right now.
So you're in session?
Well, we're in session. However, because of the pandemic, we haven't been able to meet in session. Other legislatures in other states have attempted to meet, only to have individuals infected, and they've been have to shut down. So what we're doing is we're really there are some things that have to happen. We got to pass a budget. We're going to have to take some emergency actions in order to help out our small businesses and individuals who are suffering as a result of the slowdown in businesses as a result of the pandemic. But we're also going to have to take care of some of our human services needs. People who are in their own home, who are elderly, still need services, and we have to make sure those services are funded. I think the governor can do so much, only so much through executive order, and then we're going to have to go back to Springfield sometime in the near future, and we're going to have to take some legislative action to help us move forward. There's also a myriad of federal or state legislation that's going to help us with federal aid, like a hospital assessment program that's going to provide like $3 billion into assisting into our hospitals and making sure that they're adequately funded. That has to be passed by a certain date so the federal government deadlines are met so we can get federal matching money for that. So we'll be back soon. Right now it's kind of a wait and see what happens. Yet every day we're working, every day I'm working, And you can get our office by the numbers that I gave, or you can just go online and find how to get a hold of us.
Give that one more time.
It's Rep, R-E-P, J-A-Y, Hoffman, H-O-F-F-M-A-N, Rep J. Hoffman at gmail.com. And the phone number is 618-416-7407. And there's one other thing I'd like to bring up if I could. Actually, two other things. First of all, if your doctor is in Missouri, now because of executive order of the governor, even though they are a licensed physician in Missouri, they can now do telehealth here in Illinois. So you won't have to go, as long as they, the hospital system, and they provide for it or allow for it, you won't have to drive over to St. Louis for your medical visit. They now, under Illinois law, can provide, under executive order, can provide telehealth across state lines. We already could do it within the state. Now you can do it across state lines. And then finally, if you are facing your registration is expiring, your title and registration, or your vehicle registration, or you're in need of a duplicative driver's license, you can go online at the Secretary of State's site. That site is www.cyberdriveillinois.com. www.cyberdriveillinois.com. You can renew a lot of these things online without having to go to a driver's license facility. As you know, Chairman, the driver's license facilities are closed, and they're now going to remain closed through the executive shelter in place, which is executive order shelter in place, which is April 30th. Hopefully, after that, they'll reopen. But in order to avoid lines at that time, you can go online and do a lot of this. In addition, if your driver's license or registration is to expire during the time that the driver's license facilities are closed, you will have 30 days till after they reopen in order to get that renewed. So you don't have to worry that you're going to be cited for having an expired driver's license or expired registration. But if you can get them online, you might as well do it, get it done, so you don't have to wait in line when the driver's license facilities reopen.
We appreciate you, Jay, and those 2 pallets of PPEs, we've got 30 orders from local departments that they're going to come pick up a lot of what's on those pallets tomorrow. So
And hopefully there's more to come, not only for first responders, but for the Department of Public Health, as well as for our hospitals and nursing homes.
great. Mr. Simmons, have you got anything?
Good. I just want to thank Jay. We've got him on speed dial, and I can always tell when I call him, it's, what's going on? What do you need? So we really appreciate that, Mr. Hoffman. Real quickly, a few things on the EMA side. Daily conference call every morning at 8 o'clock with the hospitals and the EMS system again this morning, exchanging that information. We talked yesterday about mobile signs that we've had put out around the county. We now have about 15 of them out, thanks to Fairview Heights and O'Fallon. They had some of their own. They've put them out there, so you're seeing those messages to practice social distancing and to stay home. That's the message we want to hear. We assisted St. Elizabeth's Hospital today on a transportation issue they had. We were able to hook them up with a provider to get that taken care of for them. We received our second order of the hand sanitizer, thanks to the family in Belleville who made that generous donation, and to Stumpy's. Great stuff. So we really appreciate that. And we talk about our first responders. We did that today with Phil and you, Chairman, and we don't want to forget them, but there's a lot of other people out there that's just as important. You know, our people who does our cleaning, the Foley janitorial people, they've really stepped up to the plate. As we said yesterday, our first responders, our fire, police, law enforcement, those are the heroes out there on the front line. But when you stop and look at it, we're all on the front line, because if we don't stay home and if we don't get this thing broke and we can get back to normal, we're going to regret that. So please stay home and help us get through this. We'll be back tomorrow afternoon approximately at 3:30 with another guest. It'd be somebody from either St. Elizabeth's or Memorial Hospital also. Thank you.